Today I want to talk about how well do you know your patients. And the reason why I think that's important is sometimes we think we know our patients really well and we prejudge and we turn out to be wrong. And that prejudgment can be very, very costly. And I continuously hear lessons from the field, from my coaches about, hey, we had this patient come in, we were going to recommend this, but the coach challenged the doctor and just said, hey, is that the treatment you would give your family? To which the doctor said, well, no, probably not. And the coach said, what would you give your family? And next thing you know, it's a completely different treatment plan. How often does your marketing, your case presentation, your phone skills, the design of your office miss the mark for what you want? And I think there's some important lessons to be learned there. And the big lesson I really want to learn is, what do you want for your practice? And it's all about starting with, what is it you want your practice to look like? What do you want your patients to look like? Your physical practice, your day, your total experience to look like? And if you start with that in mind, then you can design backwards where you are today and a pathway to get to where you want to be. And if you don't do that, you will be perhaps marketing to the wrong person. If you're marketing high-end cosmetic dentistry and all your patients are blue collar who can't afford it, don't want it, and I put those in exclamation points because that might be wrong, you might be missing the mark. If you have a spa dental practice in the Bronx the Bronx would be a bad example because that's like the new Manhattan of New York, but in an area where they just could care less about those services, that experience, it doesn't resonate well. Who is our ideal patient? What do we want them to look like in terms of age, income, type of dentistry, kids, no kids, all of those things? What do we want our ideal client base to look like? And then the next question becomes, does our practice fit that? Do we have 1980s shag carpet and wood panel walls, and yet we claim to be the cosmetic dentist who does all the amazing stuff? If that's the case, it doesn't work. It's incongruent. So does our practice model fit our dream? And if we've lost the way on our dream, let's talk about it here today before you finish your little meeting this morning about what do we want it to look like, and let's get refocused on it. Because I know what happens if you get refocused on it, things come true. So I'm going to leave you with those homework assignments. Send that to your coach. Email your coach with, hey, this is what we think we want now, and let's course correct. We've talked about that before. It's okay if we get off course. We just need to course correct and head right back to it. And in another month or 2 or 3 months, you should revisit this topic again and go, are we still headed the direction we want to be headed? And if we are, fabulous. If we're not, we need to work on that. So with that, I'm going to sign off for the day, leave it a little bit short so you have time to talk about some of these things I've given you. And I look forward to seeing you next week, 8 o'clock Mountain, 10 o'clock on the East Coast. Until then, have a wonderful day. What if you could have the practice of your dreams? What's holding you back? Imagine a life where you have everything you ever wanted.